The greatest difficulty I have as a practitioner working in this area is I work with many, many talented colleagues, not just in health and mental health. So not just GPs or school nurses or colleagues of mine within child and adolescent mental health services, but also teachers. And teachers are a fundamentally important resource because they often can see and spot very early on problems in children. 6 children in every classroom of 30 will have some kind of mental health problem. We know that now in terms of prevalence rates. The problem is what happens to these children, and that is a crisis that we're facing here in the UK but also globally, where there is a very, very poor provision for children and young people with mental health difficulties. So what I see are either children coming very late on in the development of their difficulty, so either because it hasn't been picked up early enough or because they've sat on long waiting lists to see practitioners, so we're seeing them in greater crisis than they were when they first presented. Or, for example, colleagues at school, friends of mine who are head teachers and teachers who say, but what do we don't know where to send these children, there are no spaces in CAMHS. And when you have children who have to be put onto adult psychiatric beds, or even worse, are held in police cells as a place of safety because there is nowhere for these children to go, when they are in crisis and we have such a lack of beds available to these children and such a lack of early service provision to pick these children up before they reach crisis, I question us as a society, because if in the developed world, if we cannot look after the youngest of our species, our future, if we cannot take responsibility for their care and nurture, particularly those who are most vulnerable and in crisis, what kind of society are we? As you can see, it makes me very angry. And that's why I'm an ambassador for The Place to Be, because it's organisations like The Place to Be that offer a safety net for schools, for example, where there are children who desperately need help and there is nowhere for us to send them. People like me are few and far between, and our services are struggling with cuts and lack of resources and lack of access to people like me. So The Place to Be is a vital, vital organisation. And the reason it's so popular, the reason it's doing so well, and the reason the pickup rates are so high is because we're in crisis and we need The Place to Be.